My name is Dr. Chris Slininger, and I'm an upper cervical specialist with the Pierce Clinic of Chiropractic. Concussion is known as a brain injury primarily, but more and more research is showing that concussions are primarily an injury to the upper neck. In the sports medicine world and in athletics across the country, both professional and amateur, all the way down to school sports level, concussion has become a hot topic over the last few years. Unfortunately, the understanding behind concussion is focused much more on the symptoms of concussion rather than the root causes of what might be causing it. So as a craniocervical specialist, I've spent a lot of time focusing on the upper neck and the brainstem area, but there's some really important things we need to really understand what's going on with concussions, what's causing the concussions, and what we need to do to actually get concussions managed well so that athletes can continue their athletic career and preserve their brain through that entire career. With more and more research talking about how concussion symptoms are actually coming from the neck, it really begs the question, is a concussion a head injury at all? Now, obviously, it's a hit to the head. That's why we call it a concussion. We see a head impact happen, someone falls backwards, maybe there's a head-on-head collision, or somebody gets hit really hard from the side in the head during a football game or a boxing match or MMA fight. But just because the hit or the impact was to the head, we still need to find out where it's creating the biggest effect on the body physiologically and neurologically. You see, athletic trainers actually get a firsthand look at the discrepancy between the idea that this is a head injury and the reality that it might actually be more involved in the neck. When athletic trainers evaluate an athlete who just got hit or received an impact to the head or fell in a way that either knocked them out or got them dazed a little bit, they're gonna do a field side test. And these field side tests include primarily cranial nerve tests. These cranial nerve tests are testing the cranial nerves, which don't actually come from the upper portion of the brain, but they come out from the brain stem, which sits in the lower part of the brain and the upper part of the neck. So they're actually evaluating an area that's called the craniocervical junction and a little bit above that. So when an athletic trainer does this field side evaluation, what they're actually doing is testing brainstem function far more than brain function. Now, there can be other signs and symptoms. For example, sometimes an athlete will get disoriented or confused, and that is a warning sign that it might have some brain involvement. So often, an athletic trainer will send that athlete off to get scanned and evaluated neurologically, which is focused mostly on the main part of the brain. However, many of these tests come back negative. And so the athlete is left wondering, why do I still have the symptoms of a concussion, but no findings that are definitive? And so the common recommendation once somebody is diagnosed with a concussion is literally to watch and wait and see if the symptoms resolve. That's not treatment. That's literally just watching and waiting. And sometimes the athlete will be given some drugs or some medication to ease the symptoms. But again, that's just managing the symptoms and not really getting down to the root. So let's explore that root cause for just a few minutes. You see, there's some incongruencies with the current models of what a concussion is and how it's affecting the brain. And there's also some other structures that are more vulnerable than the brain in a head impact. Let's start with the incongruencies in the current models. One of the main models that's being propagated in the concussion world is that the brain bounces against the inside of the skull. So it's a brain bounce model. Now, we've seen the movie Concussion. Most of us have seen the movie Concussion with Will Smith. And in that movie, there's a scene where Will Smith is showing his girlfriend this jar with a little brain in it, and it's about 2/3 of the way full of water. And they're watching football, and he's explaining how every time a football player will take an impact, their brain hits the inside of the skull. And he uses the model, this glass jar, to show it, and the brain will smack against the side. And obviously, they add a lot of dramatic sound effects to make it seem like a huge impact. But there's a really big problem with that model because the brain does not function the same way. Inside the skull, the brain sits in fluid, but it's all the way full of fluid. There is no air in there. So the model that was used in that movie Concussion uses both hydrodynamics, which is the way the fluid moves, and aerodynamics, which is the way air moves, and it actually allows the brain to hit much, much harder on the side of a glass jar than it could ever hit inside an enclosed cranium with only fluid and no air. So what we're talking about is adding an aerodynamic understanding, or the way air moves, inside a model for a structure that has no air. And so you're not going to get the proper dynamics of how those things are interacting. The brain really does not hit as hard as it looks when you fill the jar only partway with water. You see, in this aerodynamic model, where you do leave some air in there, it allows for something called sloshing. And that's another term that's often used with what happens during a concussion, is that the brain will slosh and hit the side of the skull. But again, sloshing can only occur when there's air space for the water or the fluid to flow into. And it's kind of like a wave hitting up against a pier or a jetty or a seawall. It will splash upward and it will slosh against the side because it has somewhere for the fluid to flow. Sloshing cannot happen in an environment that only has fluid. That would be purely hydrodynamic and it would not have any aerodynamic properties. So sloshing is also not an appropriate model. My dad actually played a trick on me when I was about 7 years old. He actually took this jar and he took a mason jar and he put an egg inside of it and he filled it completely with water and slid the lid on it and sealed it up. So there was absolutely no air inside. And he said, I'll give you $5 if you can make the egg hit the outside of the jar. And I thought, hey, this is gonna be the easiest $5 I've ever made. So I took this jar and I started shaking it harder, shaking it every which way. And I could not get this egg to impact hard on the side of the jar, no matter what I did. And he was sitting there laughing. And my dad has an engineer mind, so he knew that wasn't gonna work. But what he said is, see, you think it's gonna hit the inside, but when there's only fluid there, it only follows hydrodynamics, and the fluid will create a barrier so it'll get really close to the side, but it won't be able to impact because the water doesn't move away fast enough. So even at a young age, I was able to understand this hydrodynamic property of how the brain moves inside the skull. I just didn't know it was applied to concussions until much, much later. And the third one is brain bruising. Now, obviously there are some findings in some more severe concussions of some damage to the actual brain. There's evidence that something has happened where there's bruising or bleeding on the brain from a very severe impact. But a great majority of the people who are scanned and evaluated don't come back with positive findings, but still have pretty severe symptoms. And like I said before, these symptoms are often associated with the neck. You see, the upper neck is a very unique structure. It's called the craniocervical junction. And this craniocervical junction is designed much different than the rest of the neck and the back. It's made up of very small ligaments and very weak joints. It's great for moving your head all over the place, but it's very vulnerable to impacts and whiplash type injuries. So for a concussion, it actually takes about 60 Gs of force to create a true concussion with damage to the actual brain. It only takes about 4.5 Gs of force to start to impact or damage the upper cervical spine, which can often lead to a misalignment of the upper cervical spine. So that means when you get hit, you're actually 15 times more likely to injure the upper cervical spine than you are likely to damage the actual brain, according to those impact models. But then we have to ask the question, what is causing all these symptoms of concussion? Because we talk about it being a brain injury and it seems neurological, but why do we have the symptoms that we have? Some of the main symptoms that people experience are headaches, neck pain, dizziness, balance issues, sometimes loss of focus and concentration, and the list goes on and on. Well, there was this study where 183 hockey players, professional hockey players, were monitored throughout their season, and a number of them got injured during that season. Some of them had head impacts where it was considered or categorized as a concussion. Others were hit in the body or close to the neck and the shoulder, and it created a whiplash type injury. But when they matched the symptoms up side by side, it was just about an identical match. And what that lets us know is it doesn't really matter whether you get hit in the head or hit in the body. If you have enough force going through the spine, and especially the upper cervical spine, it can create similar symptoms. So then we have to ask the question, is it the same symptoms coming from different injuries, or is it actually the same injury, but from different forces in different areas? So if it is causing an upper neck misalignment, then we need to be able to associate the symptoms with an actual finding or a problem that could be coming from the neck. Otherwise, it doesn't make sense why you have the symptom itself, if it is a neck injury after all. There's 9 main ways that the upper neck can cause some of the symptoms associated with concussion. Number 1, A rapid impact to the head or the neck can cause a tearing of something called the myodural bridge. This is a little ligament that attaches the muscles of the upper neck to the outer covering of the central nervous system right at the upper neck. And when that little ligament tears, it can cause a tremendous amount of pain and pinpoint headaches right in the back of the head. Number 2, when there's a misalignment of the upper neck, it can affect the nerves in the upper neck area, especially the craniocervical junction area, and one of those nerve structures is called the trigeminal nucleus. The trigeminal nucleus is the pain center for the head and the neck, and so when these nerves get affected, even if you don't have pain or an injury in a certain area of your head, it can cause you to feel pain in the neck and the head, so it accounts for a lot of the headaches and the neck pain that come from a concussion. Number 3, a misalignment of the upper neck can cause a problem in vestibular functions, which are also balance functions or your sense of balance. So dizziness and imbalance are a common symptom of concussion, but it's because the vestibular nucleus, which is the command center of your balance and posture functions, it sits right in the upper neck area. So when these upper neck bones get misaligned, it can cause an interference in the vestibular functions, leading to balance problems and even more dizziness. Number 4, when the upper neck bones get misaligned, it can also affect the blood flow both to and from the brain. Now, the blood vessels that are going to the brain, the main ones are the vertebral arteries and the carotid arteries. When the upper neck bones get misaligned, it can actually put pressure on mostly the vertebral artery and occasionally the carotid artery, and it will diminish the blood flow to the brain. And it tends to affect the balance functions of the body more than the central part of the brain. But when the blood flow is compromised, even slightly, it can lead to long-term balance issues that can only be corrected by correcting the alignment of those upper neck bones. And with that, it can also affect the blood flow out of the brain, mostly through the external jugular vein. The external jugular vein goes right down along what's called the atlas bone, which is the top bone of the neck. And when that atlas bone gets rotated or twisted out of alignment, it can actually cause a compression of the jugular vein, and it's kind of like clogging plumbing. It will affect the blood flow out of the brain and back up fluid inside the brain, leading to things like brain fog, pressure in the head, and even more headaches. Number 6, when the upper cervical spine gets misaligned, it can actually cause interference in the flow of what's called cerebrospinal fluid, or CSF. Now, the cerebrospinal fluid is the fluid that the brain sits in. It helps nourish the brain, it helps clean the brain, but it also helps protect the brain in the event of an injury or a hit to the head like a concussion. So when you have a misalignment of the upper neck, it can actually cause that fluid to either back up or become turbulent, which leads to headaches, pounding in the head, and pressure in the head, as well as brain fog. Number 7, when the upper neck gets misaligned, it can also cause interference in what's called the limbic system, or the emotional center of the brain, and it puts us into chronic stress. Another term for this would be fight or flight. And so our body will start to respond in this fight or flight state, and it means that we're gonna have tighter muscles, we're gonna have poor blood flow to our organs, which means poor digestion, higher heart rate, higher blood pressure, and a more difficult time concentrating. The lower concentration is a big part of chronic stress, and that's a big reason why after a concussion, it's very hard to focus on things like reading or studying. Number 8, the upper neck is very closely related to our eye movements. And so when we get a misalignment in the upper neck, it creates a neurological mismatch with our eyes, because our head seems to be in one place and our eyes are telling us that we're in another place, and the information going into the eye center of the brain is a mismatch, and it causes our eye movements to become disrupted. So it becomes harder to focus on certain objects, which is why some of the tests that are done on the field side tracking eye movements show that the eyes are not working as well as they're supposed to be working. This can lead to poor vision or even increased headaches because the eyes are not perceiving the world the right way. And number 9, generally speaking, an upper neck misalignment that can happen from a concussion will affect the greatest majority of the cranial nerves, which is why when an athletic trainer or somebody does a field side test after a concussion and they check the cranial nerves like facial movements, facial sensations, the sense of taste, tongue movements, and even hearing, those things can be directly related to something going on in the upper neck itself. So with all of these symptoms associated with the upper neck, it is imperative that the upper neck is a primary part of the care of someone who gets a concussion. Proper evaluation and treatment of the craniocervical junction is going to be the keystone to recovering from the symptoms from concussion and post-concussive syndrome. Now, I would not recommend getting a general manipulation from a chiropractor after a concussion because the force that's experienced in a concussion can destabilize the upper neck. Basically, it's spraining the neck like a whiplash does. Let's say you injured an ankle. If you sprained an ankle, you wouldn't want someone twisting your ankle in order to make your ankle better. Instead, you'd want to stabilize and align that ankle so it heals in its correct alignment. The same exact thing is true with the upper neck. That's why I recommend upper cervical care with an upper cervical specialist. It allows for corrections being done in a neutral position, which means your head is in line with your neck the way it's supposed to be, and it's a very extremely gentle and precise way to approach the upper cervical spine. This limits the risk of your care and maximizes the benefit. So the type of chiropractic care that does this is called upper cervical care. And the procedure that we use at the Pierce Clinic of Chiropractic is called the advanced orthogonal technique. Now, there's a couple key features about advanced orthogonal care that really make it stand out. Number one, we take very advanced imaging, very specific x-rays of the upper neck, and in the event of a concussion, we often also take a very specific series of MRIs to evaluate those ligaments that hold the upper neck together. This advanced imaging allows us to be very precise in the way we analyze your problem and create a game plan to correct the problem so that it's not just relief, but a long-term change that you get to experience the benefit of. It's extremely gentle. The advanced orthogonal technique uses a percussive sound wave correction, which means that we're not doing any twisting, cracking, or popping of the spine whatsoever. In fact, you're lying down on a table and the force that we're using is nearly imperceptible to you. And because that force is so gentle, we can actually intervene very early after a concussion is experienced without the same risk as a typical manipulation. It's very precise. Every single person who gets corrected through the advanced orthogonal technique has their own unique bone structure analyzed and their own misalignment calculated from the imaging that we take. And because everything is customized to you, each individual person has a customized correction that makes sure that their own spine is aligned according to their own anatomy. It's also extremely scientific. Because we use math and because we try to take as much human error out of the process, it allows you to experience consistent care every single time you come in that's unique to your situation. This technique is very advanced and we always stay on the cutting edge, constantly evolving our procedure to make sure that you have the best approach possible to your return to play and your return to athletics with minimal or no symptoms, if possible, through that upper cervical care and getting the brain and the spine working correctly. And lastly, the ultimate goal of this procedure is the focus on holding that proper alignment. So the goal is not to continuously and repetitively adjust you, but instead make the corrections necessary to get it to stabilize and hold in its proper alignment, leading to long-lasting changes. So how does this benefit an athlete? Well, you know what it means? It means that we're going to be getting you back to play faster. It's going to minimize the short and long-term symptoms by dealing with the root cause of the problem and the most likely cause of the symptoms that you've been experiencing after a concussion. By focusing on stabilizing the spine in proper alignment, it's actually setting you up for a more stable spine throughout your athletic career. And it provides some answers as to how stable your spine actually is and how safe it is to return to play, because we're able to define the problem so clearly. So returning to the original question, is a concussion a brain injury or is it really a neck injury with some brain involvement? What we know is that the neck is almost always involved in concussions and post-concussive syndrome. And by correcting the neck, we're changing the lives of athletes and others who have experienced concussions before. Now, this is not a suggestion to skip typical concussion protocols, but what this is a strong recommendation to include upper cervical care as a main point of care for the recovery from concussion. If you're interested in learning more about upper cervical care, or you're interested in booking an appointment, please go to pierceclinicstpete.com or call us at 727-528-8700. We'd be happy to help you find out if upper cervical care is right for you.